Welcome to the pharmacology class, and today's topic is antifungal uh, drugs.
Mm-hmm.
And antifungal drugs uh, are not effective against the bacteria, and vice versa. The uh, antibiotics are not effective against the fungi because uh, fungi have different structure of the cell membrane that is different from the bacteria and mostly contains ergosterol uh, and does not contain the peptidoglycan as bacterial cells. And also, fungi are eukaryotic, uh, unlike the bacteria, and they that is why they are not uh, susceptible to the most of the antibiotics, and due to that reason, uh, diseases are very common after antibiotic treatment, especially if the antibiotics are broad spectrum, and um, candidiosis is very common after the treatment of the bacterial infections. And that is why the uh, antifungal fungi drugs are used very commonly, and in recent years, the uh, the frequency of the fungi diseases that are called mycosis, yeah, has been increased tremendously because of the uh, because of the low uh, because of the weak immune system of the patients after the organ transplantation, the cancer patients, and also the HIV patients. So all these groups have immunocompromised patients, and they are susceptible to the mycosis. And that is why the number of the uh, drugs increased as well. And today the classification includes different groups that uh, and the classification includes the two main groups. First group is drugs for cutaneous mycosis, and second is drugs for systemic mycosis. So also the drugs for systemic mycosis can be used for treating cutaneous uh, infections too. So the first drug is available for the treatment of the fungi is amphotericin B, and amphotericin B is produced by the streptomyces, so it's produced by the bacteria. And then also fluconazole is a triazole derivative of that uh, that triazole uh, has a triazole chemical structure like itraconazole, ketoconazole, posaconazole, and voriconazole. So these are azo antifungal drugs. And then the drugs for cutaneous mycosis are used for the treatment of the dermal form only. So when the fungi is located on the surface of the skin and will not penetrate to the blood and make a systemic or disease. And then the drugs for the treatment of cutaneous diseases include grisofulvin, griso like a grizzly bear, and also miconazole,
Excuse me,
nistatin.
sir. One question. When we will finish the lecture for today, because my teacher she asked me when I can get the model. I have a model. I didn't pass it yet.
We will finish as I will complete with the lecture. So
Yeah,
about
I do understand that. I mean, but
45
just
minutes.
a time.
45
Uh,
minutes. Baha,
25.
I'm
Okay.
recording the lecture.
Okay. Thank you, sir.
Your voice is recorded too. So then you can um, uh, enjoy that on YouTube. So
Okay, sir. Okay.
then unfortunately I don't have a director to cut this, so that is why please don't interrupt.
Okay.
So then nystatin and is most commonly used drug for cutaneous mycosis, and terbinafine is also commonly used, and then clotrimazole is actually uh, also common. Others are less common but still can be used for the treatment. Terbinafine is also common. So this can be used for the treatment of the cutaneous mycosis, so usually applied in form of the creams, ointments, sprays, and have a
Hello.
local uh, action. So the classification of the fungi includes two types of the fungi. First type is the most important type is yeast, because yeast is used to produce a beer. Do you like beer? Baha,
Well,
Like what?
beer,
Yeast?
beer.
beef. I
No.
Do you
Who
drink
is not
beer?
afraid from beef؟ اللي هو النحل مو؟
Beer. البيرة.
Ah,
Beer is in pubs.
Yes, yes.
You know?
Alcohol.
Alcohol.
Mm-hmm.
Baha, do you drink beer?
I no, I never drink it.
Really? Okay.
Yes.
قولي الحياة بهاء.
I
لا
know
والله ما.
that it's haram for Muslims to drink alcohol, but for the most of the population, beer is very important, especially for the men.
It's not about haram for
I
me. I
drank it
just see my
before, but
friends
it
who they
was
are
beer
drinking.
without alcohol.
Yes, they also produce some without alcohol, so
Yes, but I don't like it.
you don't
Mm.
like. Okay, yeah. So and Baha, do you try the non-alcoholic beer?
Not alcoholic beer. I tried it because it is good for the body and
أمال بتكدب ليه بهاء؟
لا والله it's really good.
Good.
شو يسمونها؟ الكلية. For the kidney. They are really so good for kidney. I think you know that, sir.
So
So sometimes I try it when I eat a lot of much and get a protein shake. You
okay.
know, when we are in the gym.
So I'm glad that you like the beer. So it's like most men like the beer. So that is why yeast is very important. So yeast is used to produce the beer. So Baha, so you should learn this very well. So you can even produce the beer yourself. So and then the second important type is malts. Malts are Baha, for you to understand what is the malts, it is a thing that will grow on the cheese if you forget it in the fridge.
Ah,
Do you remember? It's green thing that on the cheese.
yes.
So this is
Yes,
mold.
yes,
This is mold.
yes.
So there are two
Um,
types of the fungi, so yeast and molds. So for the yeast infections, most common types of the species is Candida, and Candida albicans is most common. So different species of the Candida will usually develop the diseases of the mouth, vagina, and some uh, uh, newborns infections um, in the and then the second is pneumocystis jirovensii, and pneumocystis jirovensii is only seen in HIV patients. So it's usually in the form of the pneumonia. So and then Cryptococcus neoformans is actually seen in newborns. So then the second type is the moles, and moles are usually systemic infections, and the species are Aspergillus and Mucormycosis. So these two types are least common, and then there are some dermatophytes too. So these are the moles, and then there are dimorphic that are actually even less commonly seen. So these are types of the fungi that are um, important for the uh, and will lead to the diseases. So the uh, mechanism of action of different groups of the antifungi drugs includes the uh, inhibition of ergosterol synthesis, that is common for imidazoles and triazoles like fluconazole, and then the inhibition of the DNA synthesis, that is flucitazine, and then inhibition of the mitotic spindle is grisofulvin. Grisofulvin is uh, the name is common with the grizzly. Grizzly is a type of the bear that is in the woods, in the forest. So that is what grisofulvin, because this spindle looks like uh, the nails of the bear. And then there is a plasma membrane inhibitors or polyens. This includes amphotericin B. We will discuss this in detail very soon. So and then the cell wall inhibitors are echinocandins. This is a new type of the drugs. So the amphotericin B is the most common drug used for the treatment of the fungi diseases or mycosis, and the mechanism of action of amphotericin B is based on the connection with the pores in the fungal cell, and uh, that leads to the leakage of the potassium ions from the cell, and that leads to the death. So amphotericin B interacts with the ergosterol, that is the main component of the membrane of the fungal cell, and makes a pore that uh, leads to the leakage. So this is actually the mechanism of action. And amphotericin B is injected intravenously only. So for the systemic infection, you can inject it only intravenously, and it requires a slow infusion. So And also you can apply it topically to the skin for the dermal mycosis. And the amphotericin B will not penetrate much into the central nervous system, but there is a little penetration to the central nervous system, vitreous humor, and amniotic fluid. And mostly is eliminates by urine, and some part is eliminated by the bile. The amphotericin B is still used for the treatment because it's very effective, and the amphotericin B uh, is usually sometimes it is used in combination with the fluconazole that increases its permeability because of the pores. The adverse effects includes the fever, chills, like running nose, uh, and then kidney failure can be seen in patients with kidney deficiency and hypotension, and thrombophlebitis is type of the anemia that is caused by the amphotericin B. So these are main adverse effects. The second drug is fluconazole. Fluconazole is the derivative of the azole derivative, and fluconazole mechanism of action is based on the inhibition of the uh, synthesis of the ergosterol, but by inhibiting the step of the transformation of the lanosterol to the inhibition of the demethylation. So this lanosterol is demethylating, so methyl group goes out, and then the ergosterol is synthesized. So azole antifungals are divided in two classes, imidazoles and triazoles. So the fluconazole is triazole. So triazoles are more effective. So the mechanism of action is the same, and spectrum of activity is the same, but the difference is in the pharmacokinetics. So imidazoles are usually given topically, and uh, and triazoles are given systemically and topically. Uh, and the all the azoles inhibit the hepatic uh, cytochrome P450, and that leads to the increased serum concentration of the drugs like warfarin, triazolam, phenytoin, and cyclosporine. So when combined with these drugs, the dose of this should be decreased, and the azoles are considered teratogenic, and they should be avoided in pregnancy unless there is a potential benefit um, for the mother is more than the risk for the child. Then uh, the fluconazole actually was the first member of the triazole group, and it's still used as a one-dose treatment for the vaginal candidosis. and also it's used for other yeast fungi. The Sometimes it's used for the prophylaxis against some fungal infections, especially in the patients with bone marrow transplant, and is also for the uh, it's used for the candidemia and coccidioidomycosis. Uh, the it's available orally and intravenously, and it's well absorbed and distributed in all body fluids, and is excreted via the urine, and that is why doses should be reduced um, if the patient has a renal uh, disease. So and the adverse effects include the the adverse effects include the headaches, vomiting, nausea, and uh, the rashes on the skin. Also, hepatotoxicity can occur, and that is why the fluconazole should be avoided in patients with liver diseases. The second, so the derivative of the fluconazole is itraconazole. So fluconazole is the most has lowest the uh, the spectrum is the uh, most narrow spectrum of antimycotic action. So the wider spectrum is seen in itraconazole. Itraconazole is a broad spectrum antifungal drug, and so its spectrum is broader than fluconazole and also broader than uh, any other triazole, and it's used for the treatment of the most of the types of the uh, mycosis, uh, and usually it's not used for the candida and aspergillus, but it's used for all other. There are two types of the forms: the oral capsule and a fluid. So the oral capsule should be taken with acidic food. So you can actually take it with the Coca-Cola, so that is slightly acidic, and the uh, 7-Up is also acidic. So do you like 7-Up?
7 Up, not actually. I don't really like the 7 Pepsi or other
You don't like?
gases. Liquid. Yeah,
So
I
do you
like
like
the natural
Schweppes?
juice.
Schweppes. Schweppes. No?
Oh, what?
Schweppes.
It's normal. Yes,
You
why
like
not?
Schweppes? Okay, good. So take it with the Schweppes. Schweppes is also acidic. Like any acidic lemon juice is also good. Orange juice.
Yes,
So any
yes.
acidic juice, you can use that with the itraconazole tablet, that is capsule. So and uh, for the fluid uh, for the fluid of the itraconazole, you should take it on empty stomach. So because
Mm-hmm.
the food decreases the absorption of the fluid. So the drug is distributed well and metabolized in liver and excreted via feces and urine. So adverse effects include the same as for the fluconazole, uh, and also the edema can additionally occur. So the headache, the nausea, vomiting, skin rash, same as for the fluconazole. Same as for fluconazole, hepatotoxicity can occur, and which should also be avoided in patients with a heart disease, like heart failure. Then there is a posaconazole. Posaconazole is a synthetic triazole with an even broader spectrum, but also like the same as the itraconazole. It's available as oral suspension for children, oral tablet, and intravenous injection. Uh, and it's commonly used for the treatment of Candida and Aspergillus infections. Then adverse effects are the same, and also the posaconazole uh, can affect the pH of the stomach and may decrease the absorption of the oral proconazole. Uh, so so uh, you should not combine posaconazole with other drugs that influence the gastric pH. So, like for example, omeprazole, sorry, is contraindicated with the posaconazole. So, omeprazole uh, is used for the decreasing the gastric acidity, so that will inhibit the proton pump. So then voriconazole is another synthetic triazole, and it has a broader spectrum than any other triazole, and also available orally and intravenously, and it's also used for the treatment of any my, mycosis, and also replaces the amphotericin B that is not very well, so it's not very good for the patients because of the pharmacokinetics is not very favorable, and so the uh, however the voriconazole is interacting with many drugs, including the herbs, and also like St. John's wort that is commonly used in traditional medicine. Do you study Zveroboy?
Zero boy.
Yes, in uh, Hypericum perforatum in on pharmacognosy. Hypericum
Uh,
perforatum. In
I
Russian, it's
think
called Zveroboy.
no, not yet. I think
Allah, Allah, do you remember Zveroboy?
It's from uh last
From
chapter.
from
Yes.
from pharmacognosy. It's not.
Ah,
It's a herb. It's plant.
actually, in
Hypericum.
pharmacognosy, I'm remembering the shapes. Like I know plants by shapes. Like imagine of plant
By ships.
by by photos.
By photos. Okay. So,
Yes, because in pharmacognosy we have a lot of photos.
okay. Hypericum perforatum. Okay, this one. One moment, I will show you. So, do you remember this one?
Yes, of course.
So, this is Hypericum perforatum or St. John's
Yes.
wort. So, the name is from the sand. So, and is used as a herbal medicine. Most popular herbal medicine in the world. So, the voriconazole uh, is contraindicated together with this plant. Okay,
Mm-hmm.
so actually it looks like this one can be different species. So when you see it like this in the field, do you remember now?
Yes, yes, of course.
So this is very common. So if you take this leaf and look through the sun to this leaf, it has a holes.
Mm-hmm.
Like I'm not sure if they show it here. Maybe they should show it.
Actually, we was looking under microscope.
No, you don't need microscope. Here, see
Yes,
these dots. These are
I
the
know, I know,
holes.
but also we was looking. Yes, holes. We was looking under microscope also.
Okay, you can look, but to see them, to identify them, you don't need microscope. You just look with your naked eye and you will see them. Holes are visible.
Yes.
So, okay, let's continue with the presentation. Uh, so, this is actually the mechanism of action of fluconazole, and the same is for the other triazoles like uh, voriconazole, itraconazole, and posaconazole.
Mm-hmm.
So these are, or they all have the same mechanism of action, but difference is in the mycosal spectrum. Not so the spectrum is different, and also the pharmacokinetics is different. So then there are drugs for the cutaneous mycotic infections, and uh, the mold-like uh, fungi cause cutaneous infections, and they are called dermatomycosis. And dermatomycosis are classified by the affected site. So, like for example, a pedicure. So uh, the infection of the feet will cause a pedis, like a pediculosis, uh, and uh, then the drugs that are used for the treatment are squalene inhibitors. So squalene squalene inhibitors include the terbinafine, naftifine, and butenafine. Terbinafine actually is oral and is the drug of choice for treating the dermatophyte onychomycosis, that is the infections of the nails. So, and the female patients are uh, very uh, anxious about their nails. So that is why they are very uh, uh, they're very susceptible for the my dermatomycosis or onychomycosis, that is the mycosis of the nails, and the that is why the terbinafine is used, because it makes the treatment shorter, uh, and uh, and the duration of the treatment is 3 months. So you you could not able to polish your nails for 3 months, and then uh, the terbinafine can be also used orally for infections of the scalp. So scalp is the skin of the head, so where you have a hair. So hair infection actually is very mycotic infection is very common, and uh, uh, many companies that produce shampoo also advertise them for the treatment uh, of the scalp mycosis. So, but most of them are not effective. So, terbinafine is available orally and topically, and the it accumulates in the breast milk, and that is why contraindicated for breastfeeding women. And the drug should be avoided in patients with renal impairment or hepatic impairment. So, because it's released by released by the urine. So adverse effects include GI disturbances like nausea, vomiting. So the same as headache. So actually, the adverse effects are the same as with the seen with the fluconazole. And then griseofulvin is the uh, drug that so this is a fluconazole, sorry, terbinafine that is actually excreted with the urine. And the griseofulvin is uh, the name is like a bear, grizzly. Grizzly is the type of the bear. Is very cute bear and very strong. And griseofulvin is inhibiting the mitotic spindle and inhibits the mitosis of the fungi. Uh, it's it has been replaced by the oral terbinafine, but still uh, it's used sometimes. The main disadvantage of the griseofulvin is that it should be used for a long duration uh, uh, time, like half year or even 1 year. So then the it's also contraindicated in pregnant women and is in patients with porphyria. So then the nystatin is also another poly and antifungal, and it's the same as the its indications are the same as the amphotericin B, and it's used for the cutaneous and oral candida infections. Nystatin is commonly prescribed as a over-the-counter product against the mild candida infections. Uh, It's not used systemically, only topically because it's toxic, and it also can be used intravaginally for the vulvovaginal candidiasis, or it can be used topically for cutaneous candidiasis. Adverse effects are rare, but can the nausea and vomiting can be seen after oral administration. When introduced intravaginally, the uh, nystatin will cause skin irritation, so irritation of the vagina. So then there are also imidazoles derivatives that include clotrimazole, econazole, ketoconazole, miconazole, oxyconazole, sertraconazole, surconazole, and um, also one another many of the azoles. So conazole, so it's they have a common suffix conazole, and these are all imidazole derivatives. So the previous was triazoles. These are imidazoles, and they are less effective, but they use usually topically, and uh, the adverse effects include contact dermatitis, vulvar irritation, and edema. Uh, and the Miconazole is also used as a buccal tablet for the treatment of the thrush. Uh, the ketoconazole is the most uh, common drug for the treatment of the systemic uh, fungi, and due to the resistance, today is rarely used, uh, and because the more effective fluconazole is available. So this uh, is all for the uh, and for the anti uh, antifungal drugs. And what are your questions? So if you don't have questions, I have a questions for you. So if a woman will uh, enter your pharmacy and then ask you for the uh, drug for the treatment of the uh, vaginal candidosis, what do you recommend?
Is a woman with what? I can't hear you good.
With vaginal candidosis,
Uh huh.
so what is your drug of choice? What you will sell for the woman with the vaginal candidosis?
Well,
Allah,
Yes, Professor.
what is your what do you think?
For what?
So what do you recommend for the treatment of the vaginal candidosis for the woman who enters your pharmacy? So the woman goes to your pharmacy and says, hello, I have a vaginal candidosis. What is, give me a tablet or give me something for treatment. What?
I don't know. I think some. antibiotics and
No,
no.
antibiotics are not effective. We just talk about that a lot.
Yes, but they're antibiotic by not high number like 250 antibiotic. And also I know that there are also for these cases um مطهرات يعني ايه
clinical.
um
What?
I think we
something like
should give her
Sperto,
micronin,
like Sperto.
What?
microgen. It's like microgen.
Allah, what do you want? What you said?
Some water, bacteria water, you know it.
Water?
لا يا ولد.
Yes, like sterilization.
Bacterial water? Allah,
Disinfectants.
no, no disinfectant. It's uh, it's a candidosis. It's a mycotic infection. Antibiotics are not effective. Disinfectants are not effective because cannot be used in the vagina. Vagina uh, is a very sensitive for the disinfection. So that is why
Sure.
you will give her one tablet of fluconazole. Fluconazole, okay?
Okay.
Okay.
So please remember that. So for the sake of the woman that will ask you, because it's very common.
Or the save of vagina.
And yes, for the sake of the vagina. And also, this is very common after antibiotic treatment. So most women, after the treatment with the wide spectrum antibiotics, will develop vaginal candidosis. So the fortunately the treatment is very easy, one tablet only, and fluconazole is very effective, minimal side effects. So that is why make sure that you
Uh-huh.
have fluconazole in your pharmacy. So okay,
Okay.
this is all for today. Thank you for joining this meeting, and
Thank you too.
Thank you. Have a good day, sir.
see you next week. Bye bye.
See you.
See you.
Bye.
Goodbye. Professor.